Mr. Speaker, today workers at Santa Maria are speaking out. They say they've had enough of this government's spin. The workers, Mr. Speaker, the workers say that nothing has improved. The workers who are speaking out today talk about bandages covered in feces and urine. These are bandages, Mr. Speaker, that are covering bed sores and other wounds.
Disgusting.
And these are bandages that are not being properly changed because the LPNs are stretched way too thin, Mr. Speaker. Bandages not being changed properly with feces and urine on them. That is disgusting, and that is not anywhere near acceptable, Mr. Speaker. My question to the Premier, why is this happening? Mr. Speaker, they did hear from those on the front lines. They heard from 49 of them who signed a letter and had it sent to the Minister of Health, Mr. Speaker. They knew about this, but the response from this government was just sloughing it off, was to get a ministry official to give a letter and say, sort this out with the ministry. We're awesome. That's this approach that we see from this Premier and from this government right now. Enough with the talking points already coming from this minister. We have workers at Santa Maria who say that there have been falls that have led to premature deaths. These workers, Mr. Speaker, say that families have not been told the whole story and do not know the truth about these falls. These are serious allegations coming from the workers. The problems at Santa Maria, Mr. Speaker, happen at other facilities in Regina and happen throughout the entire province of Saskatchewan. And, Mr. Speaker, see, they're dismissing it right now. This is the track record.
Shameful.
It takes 49 people, Mr. Speaker, writing a letter to the minister and still no action. It takes Margaret's family coming to the legislature, heckles from the other side, and no action. It takes healthcare workers coming forward, Mr. Speaker, and no action from this government. They don't take this seriously, Mr. Speaker. What will it take? What will it take for this government to realize that there is a crisis in seniors' care and that their response is failing miserably?
Hear, hear.
The government keeps claiming that short staffing is not a widespread problem, but the workers from Santa Maria who spoke out yesterday are very clear. They say the only increase they've seen is in overseers and paper pushers, not on the front lines providing direct care. And they say the quality of care has gotten worse over the last few years and that they're working short far too often. These are the same kinds of concerns that were identified throughout the CEO tour report last year. In Delmany, quote, staffing levels are inadequate. In Duck Lake, quote, staffing level is the main issue. In Saskatoon Convalescent Home, quote, the staffing levels are deplorable. They have not kept pace with the increased level of acuity of residents. From Rostron, quote, staffing levels are inadequate. From Samaritan Place, quote, residents notice staff shortages. Continent residents have soiled themselves because of it. From North Battleford, there are concerns about, quote, length of time for call bells to be answered. From Stensrud Lodge, quote, they can hear people crying for help in the evening because of staffing shortages. To the minister, how could he have forgotten about people being left to cry for help because of staff shortages?
You know, Mr. Speaker, this government just doesn't get it. You know, we saw last week, Mr. Speaker, we saw two government members heckle while a grieving family was in the gallery, Mr. Speaker, as concerns about their mother's death were raised. That's the kind of approach we see. Well, today, Mr. Speaker, I hope that this government actually listens, that they actually listen to the story of Emily Krushelnicki. Her doctor, Mr. Speaker, wrote a letter, made it very clear to the government, Mr. Speaker, that her health was too fragile to move to another facility. This government, Mr. Speaker, ignored that letter, and that's why Emily's son, Gary, is here today, because he is frustrated and he is scared because of what his mom has gone through. Mr. Speaker, Jessie Selwood was 88 years old. She was living in Sunset Extended Care here in Regina, and she died in excruciating pain last Christmas. Her death was initially deemed a natural death, but her family fought for the truth to come out. And the coroner eventually ruled that Jessie's death was indeed premature. It was related to a fall and an initially undiagnosed broken bone and pain that wasn't properly managed. Mr. Speaker, Jessie's family is here today because they want accountability for her and they want the system to be fixed.
We asked this government last week for an inquest into the death of Jerry Picot. Jerry was 42 years old. His family says he was cut off social assistance despite being desperate and homeless. And Jerry died in a makeshift shelter on the 500 block of Avenue K South in Saskatoon. The Social Services Minister said last week it was too early to commit to an inquest, so my question is to the Minister, is this government ready now to call that inquest, and will it be taking any action as a result of Jerry's tragic death?
BC Auditor's report is clear. P3 capital projects cost a lot more.
That's right.
On average, the interest rates are 3.5% higher, and sometimes interest rates are 11% higher. Even if this government's P3 schools are financed at the average P3 interest rate found in this report, this government scheme would cost at least $300 million more than if the government built and operated these schools. $300 million. That's huge money. That's money that should go to where it matters in education, not wasted on high interest. It's no wonder that Alberta has recently scrapped their P3 rent-a-school scheme. To the Minister, why won't this government release the full details, all the costs of this costly rent-a-school scheme, so Saskatchewan people can see exactly how much more it will cost?
Saskatchewan people were outraged to learn of the fat stacks of cash being handed over to John Black, this government's American lean consultant. There's nothing that prevents the release of all John Black's receipts, except for the fact of this government ragging the puck. Again, to the Minister, why won't this government table all of the receipts today? What doesn't it want Saskatchewan people to see?
Now, Mr. Speaker, new information this week shows that Saskatchewan's child poverty rate is getting worse. 1 in 4 Saskatchewan children live in poverty. 1 in 4. That's shocking and heartbreaking. My question is to the Social Services Minister. What does she have to say about this?
The government entered into a massive contract with the American Lean consultant, a consultant that even senior administrators say lacks respect, tattles on leaders if they dare question, gossips, and undermines, Mr. Speaker. And an American lean consultant whose quality of training has been blasted by frontline healthcare workers as well as senior administrators, Mr. Speaker, because they say the training isn't even based on adult teaching and learning principles. And now we find out, Mr. Speaker, that this government, it's a bit of a surprise to the minister, it sounds like, but this government paid the same toxic consultant to pitch himself and do the initial planning. Now, this government, Mr. Speaker, they tailor-made their lean contract for John Black, even though the health minister has admitted John Black doesn't even tailor his approach for Saskatchewan's needs.
Shame.
It's absolutely ridiculous, and it is an absolute waste. Mr. Speaker, my question is to the Premier. If government desperately needed a high-priced lean consultant, why wasn't there an actual competition? Why did they pay John Black fat stacks of cash before they gave him the fat cash cow contract?
Hear, hear.
It's so frustrating, Mr. Speaker, to keep finding out about even more money shoveled into the pockets of this government's toxic American lean consultant, especially when we keep hearing shocking and heartbreaking stories about what's happening to seniors in care facilities. Talk about misplaced priorities. After hearing from Margaret Warholm's family, from Emily Crucial-Nicky's family, from Jesse Selwood's family, and from the Santa Maria Care Aides, all in just in the last several days, it is shocking that this government still has its head in the sand when it comes to the seniors' care crisis. These are not isolated stories. To the minister, how many heartbreaking and tragic stories does he need to hear before he will finally recognize that we need regulated minimum quality of care standards? We need appropriate number of staff that are actually on the front lines, and we need a seniors advocate.
I recognize the Minister of Health.